Hi everyone. Today we are starting with a new topic, that is enteric fever, typhoid. See, in the typhoid basic you all know, but I want to make you clear about the causative organism, but the main is the pathogenesis. So let's come to discuss. See, typhoid. Typhoid is a type of fever. Okay, you can say it is a type of fever caused by, or is an infection caused by Salmonella typhi. Okay, this is clear. In the typhoid, the fever splenomegaly, spleen का enlargement, on palpation you will find that there is a spleen, leukopenia, malaise and loss of appetite. भूख नहीं लगना, leukopenia, malaise, there can be this type of symptom that will appear in the case of typhoid patient. Then pain in the body, then fever, rashes like red spots can be seen. Okay, this is the some common manifestation you will see, or some common symptom you will see in the case of typhoid. Then we will discuss about the pathogenesis, and that pathogenesis is very important. So come to discuss about the pathogenesis of typhoid. See, in the pathogenesis, first what occur, that Salmonella typhi enters the body through fecal-oral route or water contaminated. Okay, they enter the body, enters into the Peyer's patches of a small intestine. Once after entering into the small intestine, it will multiply there. But this time it will not cause any problem. After the multiplication, it will enter into the blood circulation in 72 hours. Okay, so in 72 hours it will enter the blood circulation, and this condition is called bacteremia, presence of bacteremia, that is bacteria's presence. After entering into the blood circulation, it will again come back to the small intestine. It will come into the small intestine. Here the Salmonella typhi colonize and then enter into the lymphoid. It will localize into the lymphoid tissue and now start damaging the lymphoid. Now it will start damaging lymphoid. And in the first week, the clinical features will appear. So now, in the clinical manifestation, in the first week, within a week, it will ulcerate and start bleeding in the Peyer's patches of intestine. Means the first area that is affected is the Peyer's patches of intestine. Then some clinical systemic manifestation will be seen, and that will be because of the localization of bacteria in the gallbladder. This bacteria will multiply here, but one point you have to remember, that cholecystitis cannot occur in the case of the localization of bacteria in this case. One thing you should also remember, that there can be late complications also. Now, when you do the stool culture, you will find that This is positive for the bacteria. Why the stool culture is positive? See, once after the localization into the gallbladder, they are excreted into the bile. See, the bile is now excreted into the urine and the fecus. And the stercobilin, this provides the color to the fecus. Since these bile are excreted through the stool and the bacteria are present in the bile, the stool culture will come positive. Stool positive for the bacteria. The route of transmission for the bacteria will be fecal route, oral route, and water which is contaminated will lead to transmission of the infection. In the risk factor, children, चूंकि वो बच्चे होते हैं उनको उतना आइडिया नहीं होता है, इसलिए चिल्ड्रंस they can take contaminated water or anything. Young adults, overcrowding, because in the overcrowded area there will be lack of population maintenance, lack of you can say that sanitation maintenance, the improper health and hygiene will be maintained. So overcrowding and poor sanitation, improper wastage water maintenance, this can lead to the bacteria Salmonella typhi to grow. Now the clinical manifestation, very important, and on the basis of clinical manifestation, when a patient comes to you, you will have to assign him. See, clinical manifestation. Typhoid fever, the incubation period is 10 to 14 days. And it is very important because the drug we give to patient rely on it. The carrier is female generally. Okay. The route of transmission discussed. Onset of the infection will be very fast, insidious. You don't know that tomorrow you will be infected with the Salmonella typhi. The fever will be mild. It can be severe. It can be acute. The fever of the typhoid will last for 6 to 8 weeks. Okay. Now, first 5 to 7 days. I am making 3 charts. First 5 to 7 days, then 7 to 12 days, and then 12 to 18 days or the recovery phase. In the first phase, you will see there will be anemia, leukopenia, constipation the patient will have, then fever, then bradycardia in the patient you will observe, then fever will be a step ladder rise, means फीवर धीरे धीरे बढ़ेगा और फिर डिक्रीज भी करेगा, उसी तरीके से फिर बढ़ेगा फिर डिक्रीज करेगा, इस टाइप से स्टेप लैडर राइज टाइप ऑफ फीवर. ये इंपॉर्टेंट पॉइंट है, आपको ध्यान रखना है एग्जाम में. फीवर विल बी चिल टाइप, चिलिंग टाइप ऑफ फीवर. देन देयर विल बी सीवियर हेडेक, बॉडी पेन, epistaxis and dry cough. In the second week, you will see that there is rose spot. Some scientists or some doctors tell that this rose spot can come between 7 to 10 days only. This will appear red, macule-like, and they will blanch on pressure. Blanching on pressure means when you put the pressure here, this macule or pressure will move further this side or this side depending upon the break in the epithelium. Then there can be splenomegaly, means the spleen will be palpable. On palpation you will find there is splenomegaly and 75% cases spleen will be palpable. Then there will be diarrhea, abdominal pain, and there will be meningism, that is stiffness of neck. In the late end of the second week, or you can say in the third week, you can observe that the patient is chronically ill. Now the typhoid injections are required. High grade this will be, severe condition this will be, the patient will require external blood, the fever will be remnant type of fever, confusion in the patient can go in the delirium or coma, that is called as enteric encephalopathy. Okay, relapse in the patient is generally seen. This relapse means once the patient is okay, but within a second week or the third week, the patient again come with some symptoms of the typhoid, and this is the milder to the initial. But in this case, you will find that the stool culture will be negative. No stool, because it is milder case, there is no localization, so it can not be the blood stool culture negative. So blood culture will also be negative. Chronically carrier state. A patient will have chronically carrier state, will not show any symptom for last many years, and they are very much excreting Salmonella typhi in the stool for the years, but due to the presence of this Salmonella typhi in the gallbladder, they are showing this feature. Now come to the prevalence. Females are generally more commonly infected with this infection, and in the lab diagnosis, investigation part, in the investigation in the first week, when you do CBC, you will see that there is anemia, hemoglobin decrease, leukopenia, then blood culture is positive for Salmonella typhi in 70% cases. In the second week of lab diagnosis, you will find Vidal test is positive. Since it is typhoid, so Vidal test is positive, and the blood culture 50% case positive. Anemia, leukopenia, and bone marrow involvement can also be seen in the stage. In the third stage and the last stage, in the third stage, you will see the stool culture and urine are positive, and Vidal test and blood culture are positive. So there are some complication of the typhoid, that is, there is body ache, there is encephalopathy, joint pain, there can be bronchitis, meningitis, then bronchitis, okay, then there can be myocarditis, then there can be nephritis, nephrotic syndrome, renal kidney disorder can be there. Then you will see that there is cholecystitis, rare, and then encephalopathy, bone and joint pain or infection can be seen. There will be hemorrhage in the area, hemorrhage can be seen, then peritonitis can be seen there also. In the treatment plan, but in the X-ray when you do for the abdomen or USG of abdomen, you will see this is the diaphragm, and here you will see there is radiopacity because of the gas present in the body, and ulceration you can observe very clearly. Okay, so this was for the X-ray or the USG. Now the treatment plan. Treatment, the choice of drug for the treatment is chloroquinolones, ofloxacin, levofloxacin, and ciprofloxacin, all 500 milligram thrice a day you can give to patient. Then for the antibiotic you can give clotrimazole, clotrimazole 2 tablet, that is 960 milligram you have to give. In the morning you can give 800 milligram and then 160 milligram in a divided dose. Then you will need to give the patient some oral IV infusion of glucose, and then you have to tell the patient that take care of your body and give patient amoxicillin, azithromycin, and chloramphenicol. This drug 500 to 700 milligram TDS and daily. Then you will give ceftriaxone. This will be in the form of infusion of IV infusion 2 gram. Okay, daily for the 14 days and 1 gram for the 7 days. 2 gram for the 2 days, sorry, 2 gram for the 2 days and 7 days tak 1 gram. Now the recent drug is in the market for the typhoid, that is type bar TCV. Okay, this type bar TCV is a choice of drug by the physician because they give protection in a long term. Hope this is the complete about the Salmonella typhi infection, that is typhoid, and hope this video is up to you and you have tell your patient when patient will come in your clinic. So this is all about the typhoid fever. Hope this video is helpful to you. Please do like, share and subscribe to our channel Ocean of Dentistry. How you can contact me is given in the description link. And videos for the oral pathology is already been uploaded. Now we have uploaded this topic from the oral pathology and general medicine point of view both, and this is very important for your clinical practice in the as a doctor. Thank you. That's all for today. For notes, join our Telegram through the link.